Dr. Erica is here with us from St. Vincent Healthcare, and we're talking about men's health. Now, Dr. Erica, it seems like women go to the doctor a lot, but men tend to skip out on their appointments sometimes, and not all men. I'm talking about some men. Why is it important for them to go to their regular doctor visits?
Right. You know, women see their well-woman visit every year. If they're in childbearing years, they see a doctor, but a lot of men, I think about 3 out of 5 men, do not see a doctor annually, and I think a big age group where men are not seeing their doctors are between 18 and 20 to 40 and 50, and so I want those men to know that there are important things to see their doctor for on an annual basis. You know, all ages need to go in and make sure that their blood pressure is okay. That's a silent killer that's leading to heart attack, strokes, kidney disease down the road, diabetes also. Most of my, I would say, adult onset diabetics don't even know they have diabetes when we finally diagnose it with some blood tests. And then, family history kind of things. What sorts of things do we really need to look for? Look at their weight, look at their lifestyle, talk about tobacco, talk about alcohol, and then depression screening. That's a big one that they would do at every annual visit, reminding people that Montana is #1 in the country in suicide, with Wyoming at #3. Depression, even when it doesn't get as bad as suicide, you need to talk to your primary care doctor. There's a lot of non-pharmacologic as well as medication-based therapies for that. Also, STD screens, if indicated, going to your doctor. And then as we get into kind of that 20 to 40 to 50 year age group, I want to make an important point. Skin cancer screening is important for all ages, of course, but I want to enforce that melanoma is a killer, and melanoma is, does not discriminate based on age between 20s and the end of life, but the average age is about 63, I think now. So there are a lot of, I've seen 20-year-olds die of melanoma, 30-year-olds die of melanoma. So having a good skin cancer screen. Testicular cancer screenings as well. Testicular cancer is the #1 cancer killer in men between the ages of 15 and 35. So learning the basics on testicular cancer screening is important. And then when you get to the magic age of 50, that's when a lot of men are kind of forced to go back into their doctor because they want to talk about colon cancer screening. And there's a variety of ways we can screen for colon cancer, but that in the general population starts at age 50. Also, prostate cancer screening for men, that's a discussion to have with your doctor, and that should start in the 40s to 50s. And then abdominal aortic aneurysm screening for any men between the ages of 65 and 75. Medicare pays for this. If they've ever been a smoker, they can get a screen with an ultrasound to make sure that that artery in their abdomen has not ballooned out and is at risk of rupturing. So there are a lot of things every year, men. I also want to enforce that having a relationship with your doctor is important, so that you're not just showing up when you're really sick. They know you, you know them, and they're available for you. And for anyone who's interested in learning more about this, my colleague, Dr. Adam Zelka, is having a seminar at St. Vincent today in the Mansfield Center at noon. And at this point, you can just stop by if you're interested in attending that seminar in the Mansfield Center, noon today, Dr. Zelka. So keep your men healthy.
Helps. Yeah. Well, Dr. Erica, thank you so much. I appreciate that.
Yep. Thanks for having me.
We'll be right back after this break.